Welcome back everyone, and thank you for tuning in. In this video, we will take a look at the video footage and review the available updates of Connor McDavid's injury that he suffered Saturday night against the Winnipeg Jets. We will also relate available information to the relevant anatomy. My name is Dr. Stefan Wilson, and this channel is designed for the edutainment of sports injuries. On Saturday night, the Edmonton Oilers played the Winnipeg Jets in a game that saw Connor McDavid playing 20 minutes and 48 seconds of ice time. It was not until the later stages of the third period did McDavid show any sign of injury. He did not play in the last few minutes of the third period, and he also did not play at all in any of the overtime period. This is uncharacteristic of McDavid, and something must be up. McDavid was caught on camera skating towards his own bench, favoring his left side. Following the game, Oilers coach Jay Woodcroft said in a press conference that McDavid's injury appeared to be muscular. Now, this statement is rather vague, but it does support the fact that there is no discernible one single traumatic event that we can pinpoint McDavid's injury to, and also the fact that he had already played in the majority of the hockey game. We can, though, correlate his supposed muscular appearance of injury with a highlight from Thursday night's game between the Oilers and the Philadelphia Flyers. In that game, here we can see how number 91 of the Edmonton Oilers, Evander Kane, falls, and while falling, the side of his head and helmet make contact with the front of McDavid's hip area, which then forces his leg backward. If you find sports injuries interesting, then please like and subscribe to support the channel. So if we break down the available replay here, we can see in detail how Evander's helmet does make contact with McDavid's left hip area. This forces McDavid's hip joint backwards into extension and also pulls his left leg across his body behind him into adduction. Anytime you forcefully put your hip and leg into this position, it will inevitably affect the muscles and connective tissue here in the front of the hip and leg. Here on the anatomy screen, we can see the specific muscles on the front of the hip and leg area. These muscles are designed to bring your hip into flexion and in front of your body. So if you take the muscle into the opposite direction, and even perhaps take it beyond its normal physiological range of motion, it doesn't like that. You will stretch and even tear muscle fibers, which then make it difficult to repeatedly and forcibly contract and use those muscles, which results in a strain or possibly even a tear. Also consider that Kane's helmet strikes McDavid in that front hip area, which can also leave some bruising and a contusion. Couple that with a strain or tear of the muscle, and that will lead to poor muscle performance, such as explosiveness and stamina, and certainly leads to pain. Other injuries to this area are certainly possible, such as a bone bruise or joint sprain, and hopefully not as severe as any labral cartilage damage to his hip. When there is more information available and an update to his injury, I will post those in the description. Thank you for watching.